Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Sue Telecat from the Bloomberg American Health Initiative, here to share more about the Bloomberg American Health Fellowship. If you and your organization are working to reduce overdoses, end violence, improve food systems, protect the environment, or support adolescents in the United States, you may be eligible for a full scholarship to earn an MPH or DRPH degree at the Johns Hopkins Bloomberg School of Public Health. From farmers to firefighters, to doctors to policymakers, the Bloomberg Fellowship can help you transform your career, support your organization, and make a significant impact on your community. Applications close on December 1st. Find out more at americanhealth.jhu.edu/fellowship.
This is Lindsay Smith-Rogers, producer of Public Health on Call. Today, a new documentary about vaccines and the anti-vaccine movement called Shot in the Arm. The filmmaker Scott Kennedy talks with Dr. Josh Sharfstein about his 5-year project to understand the rise of opposition to vaccines, starting with measles and ending with COVID. Featured in the film is an interview with a leading voice in the anti-vaccine movement, Robert F. Kennedy Jr. Let's listen.
Scott Kennedy, it is great to see you here on Public Health on Call. How are you doing today?
I'm a little tight, but nice to be with you.
Well, we're going to get into that, but let me start by asking you to introduce yourself to our audience.
Sure. So I like to introduce myself as a storyteller first, mostly working in the genre of documentaries, but storyteller and a filmmaker and a citizen of this planet and a father. So I think we are talking today as my position as a documentary filmmaker.
Tell me about, real briefly, a couple of the films you made before this last one.
Sure. I've only made 5.5. So the first one was about my wife teaching high school in Compton and her attempt to start a theater program there and put on the first play in 25 years. And she chose our town. So a great underdog story. The second one is The Garden, about the largest community garden in the country and its struggles for survival. That one got nominated for Academy Award. Great honor. And then I pivoted more recently to 2 films defending science. The last one was Food Evolution, which was a reset of the conversation on GMOs, which have sadly been turned into boogeymen by industries like organic industry and alternative medicine and others that will.
Genetically modified organisms.
Correct. And Neil deGrasse Tyson was the narrator on that and the script consultant, became a friend. And now for my latest project is Shot in the Arm, which is about vaccines and disease and disinformation around vaccines and anti-vaxxers.
So, Shot in the Arm, let's talk about how that started. When did you decide to do it?
In late 2018, I spoke to a doctor friend of mine. He said, Scott, your next project, you got to take on these anti-vaxxers. And in my wisdom, I said, oh, no, they're going to go away. Why would I need to do that? So that's about October of 2018. Cut to spring of 2019, still a year before COVID. And there was a state of emergency around measles outbreaks in the Orthodox Jewish community in New York City. State of emergency in Washington State around measles, outbreaks across Europe. And I did my lazy Google search about why is this happening? And I saw that we were on the verge of eliminating measles through vaccines in 2000. So why are we going backwards? And the first doctor I reached out to was Dr. Paul Offit from Children's Hospital of Philadelphia. And he said, Scott, it's not complicated, but it's depressing that there's people out there scaring families into avoiding safe vaccines. And it's never a matter of if, it's a matter of when you're going to see outbreaks like measles. So my first day of filming was June of 2019 at the CDC at their ACIP meetings, which is where they look at the vaccines and the safety of vaccines and which vaccines should be recommended. And I had a lot of my key players there. I had Paul Offit was there, and Del Bigtree, one of the biggest anti-vaxxers, was there, and Karen Ernst, a wonderful mom who's a pro-vaccine advocate. And I continued filming, and Paul introduced me to Tony Fauci, and he introduced me to Peter Hotez. And I also filmed with the rest of the top of the pyramid of the anti-vax side, including Andrew Wakefield and Robert Kennedy Jr. And we thought we had a pretty interesting and complex and timely film in 2019. And then COVID happened.
So it's 2019. You are working on a documentary about vaccines and opposition to vaccines. And before you finish, there's a pandemic. What was your first thought about how this would affect your movie? I'm assuming your first thought was not about your movie. Your first thought was about something else. But when you started to think, well, I've been working on this project, what was your first thought?
Yes. My first thought, like most people, was confusion. What is this? What's going on? How long is this going to last? And then as it presented itself that it's not going to be over in a few weeks, I thought for a minute, maybe we don't have a movie anymore, or we might not need our measles movie anymore, that we would hope that a once-in-a-century pandemic would get everybody to fall in line and say, how do we use the best science to fight this, including trying to create a vaccine? And I was terribly wrong. The antis got more ruthless, got more organized, spread more disinformation, and really made the pandemic much harder than it was already a difficult situation.
So tell me a couple of things you learned in making this film about the anti-vaccine movement.
They're very, very well organized. They're very smart. They're very good at building trust with different vulnerable communities, starting with parents who might be confused about why their child is autistic. And they give them false hope. These antis give them false hope that they know why their child has autism, even though there's no evidence of a connection between autism and vaccines. And they're very good at organizing in targeted areas, right? So they did it with the Orthodox Jewish community, where they penetrated that community in New York and spread disinformation about vaccines, and their vaccine rates dropped to 60% with the MMR vaccine, led to a measles outbreak. So they're very smart and they're very ruthless. They're sadly not telling the truth.
How integral to the movement and to their communications is the idea that public health agencies, doctors, officials are not to be trusted?
Essential. Yeah. And they've used that, again, as sort of part of a perfect storm. They've used mistakes from big. It's one of their favorite things they basically manipulated the David versus Goliath story to their own ends. They're David, everything big is Goliath. Big government, big pharma, big doctors, on and on. And of course, mistakes have been made by big, but that doesn't mean that you throw the baby out with the bathwater. So they've manipulated this David and Goliath story in a way that has made them look like they are heroes, but they're not telling the truth.
Their story is that the government has its mind made up, but they're the ones asking the tough questions.
That's right. Their story is that science and big pharma and big government are all in cahoots. And as Neil deGrasse Tyson, our executive producer on Shot in the Arm, likes to point out, those people have never seen science in action. The scientific method is inherently critical of the outcomes. It has to be put through the ringer of verifiable and repeatable. And so that accusation is not valid, but it sure sounds intriguing, as you'll see on our social media feeds. This is the story that they don't want to tell you. This is the story they are scared to have out there. And they use they in the broadest of terms. So it's much easier to be an anti, because all you have to say is MMR vaccine causes autism, or Tony Fauci is a liar, or on and on. It's much harder to be a science communicator because there's so much nuance and evidence that we have to present.
So in part, what you're saying is that the anti-vaccine community is criticizing public health for being inflexible, but in fact, public health is willing to take a different position as the evidence comes in, and the anti-vaccine movement itself may have a flexibility problem.
Yes, absolutely. Absolutely.
Well, let's talk about that. You really get into certain leaders of the anti-vaccine movement in this. One of them is named Del Bigtree. Tell me about him.
So Del Bigtree, he started as a medical journalist on the show The Doctors, and I guess he somehow won an Emmy for that. But he pivoted when he met Andrew Wakefield, and they made a movie together called Vaxxed, which was a terrible piece of propaganda against the MMR vaccine and evidence that it causes autism. And then he started a podcast and a YouTube show called The High Wire that he says is a news show, but he only talks about anti-vax things. So is it really a news show? And yeah, so he teamed up with Andrew Wakefield and became seen as a hero to these people that felt like they didn't have a voice.
And when he talks to people, what does he say?
He loves to repeat things like, well, do your own evidence, or they're not telling you the truth about the safety studies that have been done on vaccines. And that he says this in the film. He said, measles isn't really that dangerous. If Ebola was sweeping the country, talk to me then. He said that in June of 2019. A year later, we're in the middle of COVID, and you'd hope he would have changed his mind based on that statement. But of course, he didn't.
You also spend a lot of time with Robert F. Kennedy Jr., and I should say that you are not related to him, as far as you know. Is that correct?
Not related to Robert Kennedy Jr. No.
How did you cross paths with him in the making of this movie?
Sure. Through Dr. Paul Offit, he attacked Dr. Paul Offit in an old Rolling Stone article that was thankfully retracted. And so I'd seen some of the attacks that Robert Kennedy Jr. had made against Dr. Paul Offit, and there was no scientific validity to these attacks. So he presented himself pretty quickly as being the top of the pyramid in terms of power and using his name to influence.
So you went to see him and sat down with him, talked to him about vaccines. What was that like?
He gave me an hour of his time, so I thank him for that. He's very slippery. He can spin. He's very smart and very good with words. He's, a trial lawyer, so he knows how to manipulate words to his own ends. What he didn't see coming was me talking to him about the Samoa story of 2018 and 2019. That's where our interview really became interesting. It's probably one of the most powerful elements of the film.
I would agree with that. Tell us the Samoa story in brief.
Sure. So in 2018, 2 babies were given the MMR vaccine in a small hospital in Samoa, and within hours, they both died. We find out later that it was just human error. Nurses mixed, instead of water into a powdered form of the MMR vaccine, they mixed a muscle relaxant, and it made these poor babies' hearts stop. Awful, horrendous human error. The anti-vax movement took it as a way to say, look at how dangerous the MMR vaccine is. Sadly, the prime minister of Samoa was already fearful of vaccines because he had a grandson who was autistic. So he stopped all vaccines on the island of Samoa in 2018. Robert Kennedy Jr. visited Samoa, sort of praised the prime minister for being brave about stopping all vaccines. And you can see where this is going. In 2019, huge measles epidemic, 5,000 cases, and 83 children died of measles.
So you have a situation where there was misinformation about the vaccine. It led to the cancellation of vaccination in Samoa, and then the predictable severe outbreak that happened. And presumably that would lead to some learning by people who were concerned about children. What happened in this case?
Yeah, in this case, thankfully, the prime minister changed his mind about vaccines and reinstated the MMR vaccine. Robert Kennedy Jr. when he was visiting the prime minister, he met with other anti-vax leaders in that area of the globe. And he says that he didn't talk about vaccines, but there's all evidence that he did. And even when the outbreak happened, Robert Kennedy Jr. wrote to the prime minister, briefly said that he sent condolences for the outbreak, but tried to spin it worse and say that the outbreak wasn't caused by lack of vaccines. It was caused by a bad vaccine. Again, absolutely no evidence to support this. And clearly Robert Kennedy Jr. had a terrible effect on people in Samoa deciding to not get their vaccines, along with other local anti-vax people. And thank goodness again that the prime minister did learn from his mistake, reinstated the MMR vaccine, and stopped the outbreak.
I don't want to spoil the documentary, but you presented him with these facts. And what did he tell you?
He squirmed. You literally see him squirming in his chair. He denied and he denied, and he pointed in other directions and said he didn't have anything to do with it. He basically lied to me on camera. And he still now will continue to spin the Samoa story. I won't give him the oxygen to say all the other ways that he's lied about the Samoa situation, but he has not taken any credit for any influence he's had on it. He's never apologized for saying that the MMR vaccine killed these babies, purporting that it killed these babies when we found out that it was a human error. He never said, I'm sorry, we've got the story correct now. Let me correct myself as well. So just the opposite of what you would hope somebody who says they're trying to communicate the best science for the best safety of children would act. He has no humility.
I have to say, with the presidential election and Robert F. Kennedy Jr. being all over the news, talking about various topics, I feel like we're all in Shot in the Arm, the documentary now.
It's very strange, and I'm very scared for what could happen now that Trump has not just been elected, but has been given a great deal of power, that he could actually get Robert Kennedy into a position that could influence public health in devastating ways.
He recently was quoted as saying, well, he doesn't want to take vaccines away from anyone. He's just asking questions. What would be your reaction to that?
That's a heck of a pivot from what he has said in the past. He has said things like, there are no vaccines that are safe and effective. And then he'll say he didn't say that. And thankfully, news organizations have played the recording back to him. He'll say that he never tells parents to not vaccinate him. There's plenty of recordings of him saying things like, oh, I saw somebody with a new baby on a hike, and I told them, I hope you're not going to get that child vaccinated. So he, talks out of both sides of his mouth. But this is his largest pivot, because he's been so clearly anti-vax, even though loves to repeat, I'm not anti-vax. I've never been anti-vax. I'm for safe vaccines. So I followed that up in the documentary, asking him, so what vaccine would you say was a success for mankind? And he said, I don't know how to answer that question. So if you can't say you're a pro of any vaccine, not polio, not chickenpox, how can we not call you anti-vaccine?
Well, Scott Kennedy, your documentary is called Shot in the Arm. It's streaming on PBS. Thanks for joining me to tell me about it.
Thanks for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Cesiri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Cesiri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.